October 15th is Global Hand Washing Day. So according to multiple studies from the World Health Organization and CDC, the average hand hygiene compliance among healthcare workers is only 40% globally. Compliance tends to be highest after patient contact, not before. And one of the biggest reasons for not washing hands as often as they should includes glove overconfidence. So what are your thoughts on this data?
This goes to my core as far as what are the main reasons I became a physician and wanted to provide care to the patients. So it definitely starts with hand washing. And hand washing is, in our practice, I can guarantee you it's 100%. We actually had to, part ways with, it's just one person, but this was the case. We've been in business for 10 years, so we've had majority of our employees practicing very, very good hand hygiene, and we definitely have courage to part ways with provider if we have consistently not washing the hands, or someone caught not hand washing. In and outs, we have hand sanitizers everywhere in the office, and when we travel, our traveling medical provider bag always have the best quality brand hand sanitizer. As far as gloves overconfidence, those of us who are trained in surgery know that you can never trust gloves, so you always sterilize, and depending on procedure, obviously in a major operating room we have pretty much sterile hands, meaning we put some heavy chemicals on our skin to protect the patient. So this may be an occupational hazard later on. We do use moisturizer cream after our shift is over, after our work is done. But that's a commitment to profession. We sterilize our hands, making sure that we use hand sanitizer in our outpatient setting, hand sanitizer, or hand washing is something that we do before and after the visit. You should always presume that the glove can break, and that's why I don't know off the top of my head as far as percentage, in what percentage cases that glove would break, but this is definitely. It's great protection. It's not 100% protection for the provider. So we know what to do when we are exposed to bodily fluids or anything else that's again part of that patient exposure. But the main thing is to wash your hands so when the glove breaks, you're not exposing the patient to any hazards.
Right.